Thank you very much, Mr. Chairman. I appreciate that, Mr. Secretary. I want to continue the thought process of Senator Murkowski. I, too, am very alarmed by the suicide rate among our service members and our veterans. New analysis is showing us that every day in 2012, one of our service members committed suicide, and as you just commented, outpacing combat deaths. In our veteran population, we know a veteran commits suicide every 80 minutes. Every 80 minutes. Now, I think we can all agree on two things. First of all, our service members and their families have risen to the challenge. They have done everything this country's asked of them throughout the wars in Iraq and Afghanistan. We're all eternally grateful. Secondly, the Pentagon and the VA are losing the battle on mental and behavioral health conditions that are confronting a lot of our service members, loved ones, and as we just talked about, resulting in such extreme things as suicides. Secretary Panetta, our service members and veterans can't get needed treatment or access to needed resources without correct diagnosis. As you know, this has been a major problem for soldiers in my home state of Washington. At Madigan to date, over 100 soldiers and counting have had their correct PTSD diagnosis now restored after being told they were exaggerating their symptoms, lying, and accused of shirking their duties. So understandably, a lot of our service members' trust and confidence in the disability evaluation system has been seriously shaken in the wake of these events. As you know, I have continually raised concerns about the consistency and accuracy of behavioral health evaluations and diagnoses within the entire disability evaluation system, and have offered my recommendations on how to improve the system. And as you also know, the Army has now taken some critically important steps forward in beginning to address these concerns. Secretary McHugh has announced a sweeping, comprehensive Army-wide review of behavioral health evaluations and diagnosis back to 2001 to correct the errors of the past and to make sure our service members get the care and services that they need and that they deserve. But I wanted to ask you today, because this is not just an Army disability evaluation system. This is a joint Department of Defense and VA program, covers all the services. So I wanted to ask you why the department has not taken the lead in evaluating and making improvements to the entire system.
Senator, we are. What I've asked is the other service chiefs to implement the same approach that the Army's taking here.
To go back to 2001 and review all cases?
That's correct.
Throughout the entire system?
That's correct.
Okay, so they are all following the Army's lead now, and we will be told the evaluations and the progress of that. Who's heading that up?
Our Undersecretary for Personnel and for Health Care. Yeah, that's the individual that you need to contact.
Well, I would very much like to be kept informed, as I'm sure all of our members of Congress would. I think this needs to be transparent and clear. We need to make sure that people are accessing the system, getting back if they need it, and the only way to do that is to be clear, open, and honest with everyone. So I didn't know that we were looking at all the other services, and I'd like more information and to be informed on that as soon as possible about how that's taking place and what the timetable is and how that's going to occur.
I appreciate your leadership on this, Senator, and I'm not satisfied either. I think you know, the misdiagnosis that took place, what's happening in this area between, you know, look, we're doing everything we can to try to build a better system between the Pentagon, Department of Defense, and VA. But there are still huge gaps in terms of the differences as to how they approach these cases, how they diagnose these cases, and how they deal with them. And frankly, that's a whole area that we've just got to do much better on.
Well, you can't imagine what it's like to talk to a soldier who was told he had PTSD, his family was working with him, and then when he went through the disability evaluation system was told he was a liar or a malingerer. He was taken out of it, and then he went out in the civilian world, not being treated. That is a horrendous offense. You know, I'm chair of the Veterans Affairs Committee, and I recently held a hearing on the Joint Disability Evaluation System, and I just have to tell you, I am really troubled by what I'm hearing. Enrollment is continuing to climb. The number of service members, cases meeting timeliness goals is unacceptably low. The amount of time it takes to provide benefits to a service member who is transitioning through the system has risen each year since we began this. In response to these problems, we heard from the Departments of Defense and Veterans Affairs together about how 5 years after the Walter Reed scandal, this program was piloted, they're just now beginning to map out business processes to find room for improvement. That's just unacceptable. The public, all of us really believed that this was being taken head on, that we were dealing with it. 5 years out, unacceptable numbers that we're seeing. So I wanted to ask you what you are doing at your level to deal with this 5 years into this program. And we're still hearing statements from Army leaders about how the disability evaluation system is fundamentally flawed, adversarial, disjointed. Tell me what we're going to do.
Let me do this. Secretary Shinseki and I have been meeting on a regular basis to try to do what we can to implement improvements. And very frankly, we're not satisfied either by the progress that's being made here. Part of it is bureaucratic, part of it is systems, part of it is just the complicated.
You can't imagine what it sounds like to hear that. It's bureaucratic. I mean, if you're in this system, those aren't the words you want to hear.
And I see it every day. I'm in charge of a very big bureaucracy. And the fact is that sometimes just the bureaucratic nature of large departments prevents it from being agile enough to respond and do what needs to be done. And so a large part of this is just making sure that people are willing to operate out of the box and do what needs to be done in order to improve these systems. What I would offer to you is let Secretary Shinseki and I sit down with you and walk through the steps we're taking to try to see if we can try to shake the system and make it do a better job.
I really appreciate that commitment. I know you have not been there the entire 5 years, but I will tell you this. We've been told for 5 years that the DOD and VA are sitting down on a regular basis addressing this. Yeah. And I'm talking to soldiers that are stuck in this disability evaluation system. There are bureaucratic delays. The people that are supposed to be helping them, they're training them because they've been in the system longer than the trainers who are supposed to come in and work with them. Their families are facing, horrendous challenges as they try and figure out what the future brings months on end. People at the top are saying this is fundamentally flawed. You ought to hear what the people at the bottom who are in it are saying. Yeah. No, so I totally appreciate your saying that to me today, but sitting down and talking with Secretary Shinseki is something we've been hearing for a long time. We need some recommendations. We need to move forward. We need this to be a top priority at the Pentagon. As we transition now out of Afghanistan, this is not going to get more simple.
No, you're absolutely
Add to that the complexities of now going back and reviewing all of these PTSD and behavioral health cases. You have people who are in the IDE system right now who are saying, what's going to happen to me while you go back and review all these people? Are we putting more personnel in to deal with this, or now am I going to take another back seat as we deal with that? This is complex, it's hard, it's problematic, but it needs every single effort from top to bottom.
I know, listen, I share all of your frustrations, and my job is to make sure that we don't come here with more excuses, but we come here with action.
And I truly appreciate that comment, and I want to work with you. All my efforts are at your disposal. We do a fantastic job of training our men and women to go into the service. We still today have not gotten this right after this war in making sure that they transition back home. We have families and soldiers and airmen and throughout the service who are really stuck in a process that they shouldn't be stuck in with. We've got to get this right, and we've got to get it right now, and we need every effort at it. And I will sit down with you the minute you tell me you are available, but I want more than a meeting.
Okay, I agree. Okay?
All right. I believe Senator Shelby on his way. I understand that Senator Shelby is on his way. We have a second vote. I have to get back for that. If I would just ask your gentlemen to patience for him to return so that I can return for the second vote, I would appreciate it. I would put the committee into recess and tell Senator Shelby.
We're not going anyplace.
Okay. Good. Do you want to meet now, Mr. Secretary? Thank you very much. And with that, the committee's in recess until Senator Shelby arrives. Thank you very much.